Hey, I so welcome Doctors Kita and Tankazian and Sharma. We have a very special presentation for you today. We have all three cardiologists here to talk to you about caring for your heart during a pandemic. It sounds like it's going to be great. And doctors, I will let you introduce yourselves and start the program. Thank you.
Thank you. My name is Kenneth Kita. I'm an electrophysiologist, which is a mouthful. It just means I am a specialist of the electrical system of the heart, and happy to be here.
Thank you.
My name is Sanjay Sharma. I'm an interventional cardiologist, basically a cardiac plumber, and I'm happy to be here also.
Hi, I'm Hambeek Tankazian. I'm also an interventional cardiologist, and happy to be here, and looking forward to answering some questions and giving some information.
So, we thought about how we wanted to present today, and one of the issues that we've been facing is we've had a series of very similar questions asked to us by patients in the office, and this is kind of an unusual time. Most people are trying to cope with dealing with accessing medical care and dealing with taking care of medical problems during the middle of sort of all of this chaos. And so we thought we would hit on a couple of major topics that have come up for us in the office and see if we can sort of allay some fears, answer some questions, and bring up things that we think are very important as far as dealing with cardiac issues currently. We've divided up this talk into 4 sections, and we're happy to speak about anything else that may come up at the end. I'm going to start by discussing the first issue, which is how to get enough exercise and staying healthy during COVID-19. This is something that I've noticed in the office, that there's a lot of patients that are afraid to go outside or get exercise or be active. This obviously is very detrimental. Regular exercise is an important part of maintaining heart health, and it should be a priority for everyone. These are just a couple of tips that I've come across that I find to be very helpful. One of them is that, all of us have access nowadays to these fitness apps, which are very helpful. I've used a couple of them. They're great ways of doing exercise without equipment. They're great ways of doing yoga or bodyweight exercise or Pilates. They're kind of fun, a little like this meeting. It's a different way of doing things that we're used to doing. Another sort of suggestion I found to be pretty helpful is to use, if you don't have access to the usual gym equipment, use other equipment at home, like old stationary bikes or yoga mats, chairs, sofas. Pretty helpful. It's pretty important right now to try to avoid injury, so don't take on something that you're not comfortable with. You don't want to end up in the emergency room for an avoidable injury. It's very helpful to develop a routine and to follow that routine, especially if you're mostly at home. It's easy to get into a rut. It feels like the same day. And it's good to think to yourself, I take a walk at 10 o'clock every morning, or I take a walk in the evening, or I go on a hike, or I exercise routinely at a certain time. That's very helpful, especially if you have a routine. If you have a concern about an underlying cardiac condition that may put you at risk of doing exercise, it's always a good idea to speak with your physician. Most physicians are offering, if you're uncomfortable going in, telephone visits. We're offering telephone visits, and it is a good way of preventing issues. I think the next topic is important to all of us. It's very important to avoid binge eating or entertainment eating, especially when you're stuck at home and there isn't really much else to do. It's very easy to fill the hours with empty calories. Sorry, I went the wrong way. It is very safe to exercise outdoors, especially if you're not in a crowd. So it's safe to hike, it's safe to walk, it's safe to cycle or jog. If you feel like you're going to be close to other people, it's important to wear a mask. I hike pretty routinely, and I've noticed that a lot of people have very interesting ways of wearing masks. So I've added this picture on here on how to wear a mask. It's important that the mask goes over the bridge of your nose, that it's snugly fit around your face, and that it doesn't either ride below your nose or up above your chin. You want to make sure you have a good contact with your face. So I'm going to turn over to Dr. Tonkazian now, who's going to talk about dealing with heart attacks.
All right, thank you, Dr. Sharma. So yeah, just kind of continuing on from what Dr. Sharma was talking about, all excellent points about staying fit, staying active. And that's the reason we're all trying to do this, is to prevent heart attacks and in the first place. So I'm going to talk about how we diagnose certain symptoms to look for, and ultimately I'll talk about how we usually treat people who have had heart attacks. All right, sorry, let me just scroll forward. Okay, so starting off, a couple of key things that I look for whenever I meet somebody and we're trying to figure out if they're at risk for having a heart attack are these risk factors. If a patient has diabetes, if they have high blood pressure, high cholesterol levels, if they've been a smoker or are an active smoker, if they're overweight, and have a strong family history of heart disease or coronary artery disease, this kind of triggers an alert in my head to pay a little bit closer attention and to check for underlying heart disease. And one other risk factor is age. Unfortunately, the older we get, we tend to accumulate some of these risk factors that put us at risk for having underlying heart disease. This is a nice diagram from the American Heart Association. There are a lot of online sources that help people stay healthy and active. They give very informative information. American Heart Association is one of them. Their website is heart.org. And there's a lot of helpful information, not just about the heart, even about stroke prevention. But the reason I like this diagram is these are the common symptoms that we look for in trying to diagnose heart disease. You can see number one is pain or discomfort in the chest. Usually this is with activity, with exertion. If you're going upstairs and you feel a tightness in the chest, that's something to keep an eye on and maybe get checked out. Lightheadedness, nausea, vomiting. This is if you're having pain as well. Some people get pain that goes to the back, to the neck, to the jaw. You can get discomfort in the arms and shoulders, almost like a radiating sensation where it starts in the chest and it goes up to the shoulders, and also a shortness of breath. So if you're able to walk a mile before and now you're getting extremely short of breath and unable to do the same exercise, same activity, that might be an early warning sign for underlying heart disease. Now, when I talk about heart disease or coronary artery disease, what causes a heart attack? This picture right here is kind of an external view of what the heart looks like. The little red lines, I'll try to point it out here. These are the arteries that are at the top of the heart, and they take nutrition and oxygen to the heart muscle. What happens when you have risk factors like diabetes, high blood pressure, high cholesterol, you get clogging in your arteries, kind of like this picture right up here. So you can see the yellow residue that builds up is cholesterol that's slowing the blood flow in these arteries. And that slowing of the blood flow is what causes the symptoms, the shortness of breath, the chest pain. If this goes untreated, if it goes on for an extended period of time, it could cause muscle damage and weakness to the heart. So these are conditions we're trying to prevent. Now, if somebody comes in and they're having all those symptoms, they're having chest pain, they're having shortness of breath, and it's been getting worse, and I'm concerned that they're having a heart attack, this is how we diagnose these conditions. So if somebody's in the emergency department and having a heart attack, we would do what's called a coronary angiogram. And this diagram here shows how all the arteries lead back to the heart. So we go a lot safer and easier. pictures of artery. And A is a before picture and B is an after picture of an artery that's 100% blocked. And then this is after a stent has been placed and then it's back open. So you can see how much larger and the artery is at this point. And the way we achieve that is by putting a stent. And this is just a little diagram of what the stent looks like inside the artery. So this is the stent initially going in. And the stent is a thin platinum scaffold that opens up, has special drug coating, and then it's tubular in nature, and it clears the residue in the artery and gets the blood flow back to normal. And so we put the stent in like in diagram C, and then that stays in forever. And by taking the appropriate steps and living a healthy lifestyle, we try to keep that open for the rest of the patient's life. And then, the easiest thing, that I kind of talked about treating heart disease and coronary artery disease. The easiest thing is to try to prevent it, so we don't get to the point where we need to undergo procedures and surgeries. So just certain things we've learned over the years from different research studies. Diet and lifestyle are very important. Mediterranean diet with healthy nuts and salads, fish, trying to avoid red meats. These tend to be less inflammatory and are healthier for the heart. Leaning towards a vegetarian diet, avoiding saturated fats, quitting smoking or whether a pipe or cigarette. These are all healthy steps you can take to try to keep your heart from developing blockages. Dr. Sharma spoke about exercise. There were some recent studies that came out and showed that just doing even 20 minutes of exercise where you're brisk walking, riding a bicycle, just getting your heart rate up a little bit, just so you're breaking a little bit of sweat. Doing that 4 to 5 times a week helps reduce your risk of having a heart attack as well. And then, when lifestyle changes fail and somebody has diabetes, high cholesterol, high blood pressure, taking the medications, like prescribed, having close contact with your cardiologist, with your primary care doctor are very important to make sure that we're trying to manage these conditions as well as we can to avoid progression and development of heart disease. So the keys that I want to give at the end of this talk is coronary artery disease is a treatable condition, and it's important to try to detect it as early as possible. If you are having any of those signs and symptoms, you need to pay attention to that, and getting an EKG done or even a stress test if we have that concern, if you have risk factors, if you have symptoms, would be an easy way to detect that so you don't end up having a heart attack and coming to the hospital. And one thing we've noticed during these difficult times over the past year during the pandemic, people tend to wait longer to seek help and evaluation. So the longer we wait, a lot of times the disease process becomes more complicated. It becomes tougher to treat. So we're just trying to urge people to pay attention to their bodies. If you're having symptoms, seek help and assistance. And it's better to get checked earlier rather than waiting too long. All right, so I'm going to hand it over to Dr. Kita.
Great. Thank you, Dr. Tankazian. That was great stuff. Sanjay, if you don't mind.
Don't mind, I'm just figuring it out. One sec, sorry.
Okay, so like I kind of mentioned, I'm an electrophysiologist. So basically what I do is manage the electrical system of the heart, in particular abnormal electrical activity. So what that usually translates to is your heart is going too fast or your heart is going too slow. And today we're going to talk more about how when your heart is going too fast, and in particular, the most common reason for why your heart might be going fast is something called atrial fibrillation, or AF, which you may or may not be familiar with. And so it's a particular type of arrhythmia, and the most common arrhythmia. 2.3 million people in the US are diagnosed with it, and about 160,000 cases are diagnosed yearly. And as you get older And if you do have these risk factors that Dr. Tonkazian spoke about, as far as hypertension and diabetes, your risk of atrial fibrillation is also higher. And so for a normal heart rate, for an adult, it's usually between 60 and 100 beats a minute. However, AFib, that can cause your heart to go very fast, up to sometimes as high as 180 or 190 beats a minute. And a lot of times this actually might be completely asymptomatic, meaning you don't feel anything. But very frequently people will feel things like palpitations, which are kind of irregular or skip beats, pumping in your chest, or shortness of breath, or fatigue. Next slide, please. So here's some kind of pictures, because I like pictures and I think they're easier to kind of understand AFib. But if you look at first the picture on the left and just focus on the heart itself, basically, if you're this is a picture of your heart if it were sitting directly in your chest and you took a longitudinal slice and opened it like a book. And now you see the top two chambers of the heart, the left and the right, as you look directly at the heart, and the bottom two chambers, left, the right ventricle and the left ventricle. And so where AFib usually comes about is from the top left atrium, the top left chamber. And if you look now at the right picture, the picture on the right with the two hearts, one on top of the other, the heart on top is essentially showing you what a normal rhythm looks like. So it starts at number 1, the electrical activity, then travels down to number 2 through something called the atrioventricular node. And then it spreads out to your ventricles, the bottom two chambers, to cause it to pump so that your rest of your body can receive oxygenated blood. So that's normal sinus rhythm. Oh, sorry, go back up. So, and then if you look at the heart just below that, this is what atrial fibrillation looks like. So it's not normal and rhythmic like the picture up top, but it's actually very irregular. And actually the way we describe it is the heart is beating irregularly, which is the rhythm of the heart. And the reason why is because atrial fibrillation, which once again originates in the top left chamber, there are these muscle fibers within there that have electrical activity that have essentially a mind of their own. And they're essentially beating at 500, 600 beats a minute. Now, this doesn't all translate down to the ventricles, the bottom chambers, because of the atrioventricular node. And so what usually ends up happening is your heart rate is then more like 140, 150, 180. But regardless, when your heart is beating that fast and you're not really exercising, this is, to most people, they'll feel palpitations, they'll feel short of breath, and they'll feel disconcerted because they're wondering, I'm sitting here at rest, but why is my heart feeling like I'm, running a marathon, basically. Next slide. So why is AFib important? Basically, as a rhythm in and of itself, it's not really that important, or I shouldn't say important, it's not really that dangerous. However, it's the side effects of AFib that can be life-threatening. And so the most significant side effect of AFib is actually stroke. And the reason why this can happen is because in the top left chamber, if you look at the picture again, over to the right, I don't know, Sanjay, if you can maybe point out the appendage there. But basically, yeah, right there, exactly. So when the left atrium is fibrillating or quivering and not really transporting blood from the top chamber, the left atrium, to the bottom left ventricle, the blood moves very slowly. And so the blood then is allowed to kind of sit in that appendage area. And when blood sits, it likes to clot and form. And when that clot forms, that can then break off, go into the left ventricle, and then be pumped into your brain, which can cause a stroke. And so that is the dangerous side effect of AFib, essentially, is stroke. And how do we treat this? Oh, sorry. Well, you could probably just skip this slide. So basically, what you see here is kind of what we use as a way to basically figure out what is your risk factor for stroke when you have AFib, and it's called a CHADS-VASc risk criteria. And that's what we generally use in order to guide ourselves into whether or not someone should be on a blood thinner. But the overall way to manage or prevent stroke in AFib is to put someone on a blood thinner. So if you were to come to us with AFib, we would then ask you all the other, medical history that you might have and assess your risk factors. And based on that, you may or may not be recommended to take a blood thinner. And on the right side is kind of a list of some of the more common blood thinners that we would prescribe. And so that's how you manage kind of AFib and stroke. But also, like I mentioned, AFib can cause a lot of palpitations because of your heart rate's going a little too fast. And so there are many ways to treat this. One way would be something called rate control. And that generally means that we're going to give you medications that slow your heart rate down. And by doing so, you probably won't feel as many palpitations and you won't feel the shortness of breath or fatigue once you're on these medications and your rate of AFib is properly controlled. So if you were uncontrolled and your heart rate's something in like the 130s, 140s, but we give you a medication, then that would slow down your heart rate to maybe the 70s. And this may have then helped you as far as your symptoms go for AFib. And that's known as rate control. There's also something called rhythm control, which I think I have another slide on. Can you advance, Sanjay? There you go. Rhythm control.
Is that slide?
Oh, no problem. And there are many ways to actually do rhythm control, but one of the more common ways is to do something called an electrical cardioversion, which essentially is if this picture here essentially shows you some pads that are put on the chest, and these pads can actually deliver electrical shock to your heart in order to essentially reset it from AFib into a normal sinus rhythm. This is obviously done under general anesthesia because none of us would like getting a shock that hard. But basically, this is something that we would do in order to try to get you out of atrial fibrillation. And then after you've been cardioverted, then we would start some medications to hopefully try to keep you in normal sinus rhythm. And then on the other side, if you don't do cardioversion, is something a little bit more invasive, which is called an ablation. And these are some pictures which essentially show that we come into your heart with catheters. So if you focus on the picture on the left there, the cartoon, basically, like I mentioned, atrial fibrillation originates in the top left chamber. And so we come from the right side and we poke over through and to create a hole between the wall between your right and left atrium. And then through that hole, we pass some catheters. And with those catheters, we essentially make a three-dimensional map on a computer, which I'm showing you on the right side. And once we make that map, then we can essentially go and find the areas that we need to burn with the catheter in order to try to prevent atrial fibrillation from reoccurring in your heart. But yeah, and so that's another way of controlling AFib is an ablation. And like I said, a little bit more invasive because it is a procedure. So generally speaking, when we manage atrial fibrillation, we kind of go in a stepwise fashion, but it all kind of depends. It does depend on the patient. It depends on how symptomatic you are. We may sometimes skip some things and go straight to ablation versus maybe some cardioversion. But really it is about tailoring the care for you. I'm not sure if I have another slide, but if I do, I'll. Nope. Okay. Thank you.
I thought this would be a good thing for you and I to both comment on. One of the questions that we've been getting a lot in the office is whether vaccination is safe for patients with cardiac issues. I've just brought up some information that we've put together, and I think you'll find it kind of helpful. There isn't any specific guidance from most cardiac societies. Generally speaking, the studies that have been performed to approve the vaccinations have been very robust. They've included, at this point, hundreds of thousands of patients. These patients tend to skew older. They tend to skew towards people that are above the age of 65. And they include, unlike most studies, patients with multiple cardiac medical problems, including advanced cardiovascular disease, electrical disease, valve disease. So this has been studied in a in our population. The current studies for the vaccination show that these have dramatically reduced the risk of death and hospitalizations. And by dramatically, I mean there has been almost zero hospitalizations and deaths with patients that have been vaccinated. Probably the most up-to-date society of ours is the American Heart Association on this subject. And they've come out with a statement strongly encouraging vaccination, primarily because patients that with a history of heart disease or stroke have been noted to be at higher risk of developing severe COVID type findings and pneumonia, and they feel that those patients are at the greatest risk of the virus and have the greatest benefit from vaccination. There has been very rare complications and side effects associated with vaccinations. These are very like niche complications. These are people that have allergic reactions to vaccination, and of the millions of people that have been vaccinated, it's only been a handful of people that have had these reactions. Both vaccines that are currently approved in the United States are 95% effective. Even though these vaccines have been released pretty rapidly, they are a result of the research that was done for the SARS-CoV epidemic that occurred in 2004. The research that underlies the vaccination has been sort of ongoing for about 19 years now. So this is not something that just came out of the blue. The vaccines were developed over a long period of time. Here's just sort of a last slide that one of our medical society, American College of Cardiology, released. I think at this point, we're open to answering any questions that might be out there.
Dr. Sharma, so in the chat, we have
Yes.
a few questions. Yes.
I see a lot of questions here. So we'll start. Let's see here.
Okay.
Can I do Pilates after my heart surgery and heart attack 2 years ago? That's the first question from Antonio Ferdinand. And Antonio, I think would be a great idea to do Pilates. It says, when you make a hole, it is piercing the heart.